Welcome back. And of course, let's move to health matters now, where in recent years, incidences of kidney disease in Borno and Yobe State have soared, leaving families of victims, medical experts, and the government deeply concerned. In this report, News Central's Umaru Kirawa takes a look at this life-threatening development.
Despite being directly affected by the over a decade Boko Haram conflict, the residents of Borno and Yobe states are now confronted with an additional health burden in the form of kidney disease. The reasons behind the sudden uptick remain unclear, posing a significant challenge for medical professionals. One major concern for most patients of the kidney disease and their families is the high cost of managing the disease in Nigeria.
Ai gaskiya akwai wahala, dan musamman ni kam ni maraya ne, dan babana ya rasu. Mama ta ce sometimes take fama da kuɗin yin dialysis, dan ina yi so biyu a sati, Monday da Thursday. Gaskiya kuɗi kam yana ba mu wahala sosai wajen yin dialysis.
Na farko dai na rasa mahaifiyata da kuma yayata, tsakaninsu wata ɗaya da sati ɗaya ne suka rasu. Kidney problem ne ya kama su, sannan kuma rashin kuɗi ne kamar mahaifiyata ita ta ɗaure min gindi na samu na yi karatu. Na san da tana nan dan samu ci gaba da karatu na, amma yanzu karatu na ya tsaya.
Gaskiya muna nema gwamnati gaskiya ta shiga cikin wannan abin sosai, don abin yana ba da karfin mu.
The University of Maiduguri Teaching Hospital and the State Specialist Hospital have been managing to cope with an overwhelming number of patients who come to undergo dialysis every week.
The prevalence is high in this environment compared to the prevalence in other parts of the nation and worldwide. The prevalence in Maiduguri here and its environment, Borno State, is about 18% of our general population have chronic kidney disease. That is from the early stages up to the late stages of it. And in the nation reports a prevalence of about 12%.
To address the growing number of the kidney disease, Borno and Yobe State's government have allocated a considerable budget for research in collaboration with research institutions to develop action plan.
Africa has a huge burden of diseases globally, but also it has the most significant genetic diversity. What that means is that for us to fully understand ourselves and how to defeat diseases, we really need to study the African DNA.
I wish to, on behalf of my humble self, the members of my entourage, and indeed the good people of Yobe State, most sincerely thank you for this historic opportunity to be here with you to explore more areas to advance the course of our journey in scientific research.
While experts are still analyzing data to comprehend the causes, risk factors to come up with proactive measures and suitable treatments for kidney disease, regular medical checkup, and intake of more water is highly recommended.
Intake of enough fluids at least will reduce the pattern. That's first thing. The second thing is those that are hypertensive should be coming for regular checkups and managing their blood pressure. Likewise, those that are diabetic, those that usually take traditional medication should avoid it. Those that usually take drugs over the counter should at least be sure that be taking drugs once prescribed. If not prescribed, actually it's not ideal to be taking it because all drugs are poisons when taken out of proportion or outside the dosage range that is supposed to be taken, or outside duration of the period that is not supposed to be taken. So these are the things that we be enlightening people on. The most important thing is advocacy, and that will reduce the burden a lot.
While the kidney disease continues to silently eliminate individuals in the Northeast, more concerted efforts need to be done to minimize early deaths for sustainable growth and development. Umaru Kirawa, reporting for News Central TV, Maiduguri.
Joining me on the news to discuss this further is News Central's Head of Health Desk, of course, Dr. Kelechi Okoro. Thank you so much for your time.
Thank you so much for having me.
All right. I mean, this is a rather, well, I call it disturbing development right now. What are the contributing factors to the recent surge in kidney disease cases, particularly in Borno and Yobe State, though not restricted to these states? And what preventive measures can be implemented to actually address this?
Okay, so in recent times, the upsurge is being investigated as chronic kidney disease of unknown origin, because according to hospital records, the direct cause is not known. However, other contributing causes can be attributed to the fact that northern Nigeria, especially Borno and Yobe, are experiencing more security challenges, particularly related to Boko Haram insurgency. And as that happens, daily living is disrupted and more people are internally displaced. And they can't get adequate health care when this happens. They cannot feed properly. This reduces their immunity and makes them even more susceptible to the diseases and conditions that contribute to CKD. That is the chronic kidney diseases. Now, further research needs to be conducted to uncover the root cause of this upsurge of CKDs in these areas. And generally, at the moment, the Bade community in Yobe State has reported high cases of CKD. And there's also another community, Gashiwa, in Yobe State. And they're saying it's unknown origin. And it begs the question of what is particular about that region? Is it the food, high salt intake? Is it the lifestyle? Are they exposed to toxins? Is it that their water source is contaminated with heavy metals or harmful chemicals? That's why I'm trying to say that further research is indeed pertinent at this point, okay? But generally, people of the black race, Nigerians of course too, are 4 times more likely to develop kidney diseases than people of other races, and that can attribute to the presence of apolipoprotein L1. That's the gene that was originally meant to protect us from sleeping sickness, but now it's a problem and it's making us susceptible to kidney infections. Also, there's a burden of the other diseases that potentially increase your risk of having kidney disease, like high blood pressure, high blood sugar, living with conditions like hepatitis B and C, HIV, and also sickle cell anemia. Also, urinary tract infections for a long time. Let's not forget long use, misuse, and abuse of painkillers. And also, very importantly, the long time practice of drinking herbal concoctions, and most recently, the epidemic of bleaching of the skin. And if you ask me again, I would say this upsurge in CKD, chronic kidney diseases, is happening nationwide, with even more and more people being affected, as well as the older population.
I mean, you've actually highlighted a couple of what I call spiky factors here. And you also said something. You said that people in this part of the world are 4 times more susceptible to the disease than any other race in the world. I mean, aside lifestyle, with the prevalence of low-cost herbal products claiming to cure various diseases, how can consumers distinguish between legitimate herbal remedies and potentially harmful mixtures? And also, how affordable is the cure?
Okay, for starters, let's establish the fact that herbal concoctions are potentially harmful to our health. That Gbogbo claim of it cures everything and should be discouraged. It should be discouraged, and in most cases, pharmaceutical drugs are actually safer because, hear me out, they have been rigorously tested for safety, side effects, and interaction with other drugs and foods. They are specific for different conditions, and they have their required doses. So, while herbal products may be cheaper and readily available, we cannot guarantee that they are safer or more efficient. They can also easily get contaminated because of the way it's prepared, and that's extra problems for you. Imagine trying to solve a problem and bringing up another problem for yourself. Now, don't get me wrong. I have absolutely no problems with home remedies that help with alleviating symptoms. But when it comes to curing diseases, especially those that already come with complications and coexisting conditions, your best bet is to see a doctor and please get proper treatment. I'll repeat myself. No herbal concoction can replace dialysis or kidney transplant. You still need to consult your doctor. So, please, again, before you use any herbal product, you need to research it first. But we all know that most consumers of low-cost herbal products are mostly economically and educationally disadvantaged people, right? So they may not be equipped with enough knowledge to determine which herbal remedy is best for their condition. And that's why it's mostly up to the regulatory bodies to do this for them. So please, dear NAFDAC, apart from education and continuous education of this demographic group, guidelines for the registration and control of herbal medicinal products and related substances in Nigeria need serious upward review and strict adherence policies. Please.
Now let's elaborate on the common signs and symptoms of kidney disease that Nigerians should actually be aware of, and at what point should they seek medical assistance, particularly when these signs start to pop up.
Okay, so like so many other diseases, in the early stage, there may be no symptoms. But as the disease worsens, you can find symptoms like change in your urination. For example, you can get worse, you can increase or decrease in frequency. You can get foamy, you can find blood in your urine. You can have difficulty in urinating. Also, you can have swelling of the ankle, the legs, the face, or the hands. We call that edema. You can get persistently tired and weak. You can have middle or lower back pain. And also, your blood pressure increases. There's change in appetite. You feel like vomiting. Some people actually vomit. And then there's this metallic taste in the mouth. Also, there could be itching and skin rashes. You can have shortness of breath when it gets complicated and fluid goes to your lungs. Also, you could have swollen or puffy eyes. The sad thing is that many Nigerians are moving around with these medical conditions and they do not even know it. They're not getting treated, and it keeps getting worse and damaging their kidneys in the process. And before you know it, they already need dialysis sessions or kidney transplants. And that's why early detection is key. So please, I keep saying please, don't wait till you have symptoms before you check on your kidneys, okay? There are simple tests that can be done. There's the urinalysis, which is done with the urine, and there's the kidney function test that is done with the blood. And trust me, these are cheaper, way cheaper than spending 600K monthly to get dialysis and about 10 million naira for a kidney transplant. Now, tell me, how many Nigerians can actually afford that? How many? And most of the time, we have to crowdfund for treatment. We've seen it happen many times, not just to financially deprived Nigerians. Even celebrities have to crowdfund to get their treatment, okay? But the average and above average Nigerians have come out to seek for help countless times for their medical bills. And some, unfortunately, still died. So please, again, don't wait till it gets that bad. Do your routine kidney health screenings, urinalysis, check for your protein in the urine, okay? Do your blood test to check for creatinine and urea. Check your BP. It's very simple as that. Check your blood pressure. In a lot of places, it's actually free. Check your blood sugar. It's actually very cheap. And these are simple, non-invasive, and affordable tests.
All right. Thank you so much for your time, Kelechi Okoro.
Thank you so much for having me. Yeah.